Welcome everyone. It's really great to have you join us for today's training. I know it's a busy time for everyone, so we appreciate you taking the time to join us. I'm Safia Abdinur, Policy Analyst with the Public Health Law Center for the Healthy Eating and Active Living programs.
And I'm Julie Ralston, Aoki, and I am the Director of the Healthy Eating Active Living programs at the Public Health Law Center, and just want to say hello to everyone and thanks for being here.
And hi, everyone. I am Rachel Callanan. I'm a lead senior staff attorney at Public Health Law Center working in our commercial tobacco area. And I lead the team on our Minnesota work on commercial tobacco technical assistance.
Awesome, great. Again, we're really glad to have you all here today for today's training, where we're going to be covering this level setting on policy, systems, and environmental change. So today's training is part one of a three-part webinar series in collaboration with SHIP. The trainings will focus on policy, systems, and environmental change work to improve health and health equity, to deepen and amplify state and local public health staff's capacity, so then they can carry out effective policy, systems, and environmental change work. At the end of the presentation, we'll share more information about the following trainings in the series and how you can register for them. So hopefully you all know a little bit about us by now, but just want to provide a quick overview of our center and the work that we do. So we are a nonprofit public health technical assistance center. Our center is based in the Mitchell-Hamlin School of Law in St. Paul, Minnesota, which is indigenous land in the region known as Abidote, where the Mississippi and Minnesota River meet, and is the birthplace and the center of all things Dakota people. So the region is also home to the Anishinaabe and other indigenous people from many tribal nations who made and continue to make countless and uncounted contributions to this region through protection and stewardship of the land, the air, water, and the preservation and revitalization of indigenous foodways, demonstrating resiliency in the face of overwhelming odds. So we recognize that the land our center currently occupies was forcibly stolen and unfortunately comes with a legacy of US law and policy aimed at the attempted genocide and oppression of indigenous people, and that after everything, this land remains and will continue to remain indigenous land. So at the Public Health Law Center, we really fundamentally believe that a part of our work is to repair and address this heavy legacy of the law and apply ourselves in supporting tribal nations and exercising sovereignty to improve the lives of the community members. Next slide. Thank you. So what do we do at the center? Our work is founded on the principle that everyone deserves to be healthy. So the work that we do really at the center really supports public health officials, local public health, such as you all, advocates, researchers, as well as community members in developing public health laws and policies that are grounded in community, good science, lived experiences, as well as constructive legal principles. Our efforts focus on public health policies to prevent and reduce chronic diseases and promote equity. We concentrate on three main issue areas. So that includes supporting communities in developing policies to help community members be free of harms of commercial tobacco use, to help community members and have culturally appropriate foods or opportunities to be physically active, and then as well as access to affordable, healthy, and culturally relevant foods. So as a public health technical assistance center, our staff of attorneys and policy analysts provide various services and expertise in legal research, policy development, implementation, and defense. We also produce publications and offer trainings like today's training. Though we are a law center, we don't provide direct representation, nor do we lobby. We work with many partners here in Minnesota, in the Midwest, as well as across the country. The Minnesota Department of Health, OSHI, is one of our most important partners here in Minnesota, and we have served as a technical assistance provider for their SHIP work since it started, so which I will talk about in the next slide. So I know you are all familiar with SHIP, but since this whole training is about fundamentals, we'd figure it'd be great to revisit SHIP's goals and work. So SHIP, of course, the State Health Improvement Partnership, is a comprehensive and statewide health strategy that covers Minnesota's counties as well as the tribal nations. So the work that SHIP focuses on they support community-driven solutions that expand opportunities for physical activity, healthy eating, commercial tobacco-free living, and then also well-being, so which that includes that mental, physical, social, as well as emotional health aspects. And the work done this type of work is done in various settings, such as workplaces, healthcare, schools, childcare, to really help build thriving communities and create opportunities for all people in Minnesota to live longer and healthier lives. So the Minnesota Department of Health has a vision of equity where communities are thriving and that all people have what they need to be healthy. And so SHIP carries out that commitment to advancing that health equity in the state of Minnesota. So local public health SHIP and their partners, work collaboratively to eliminate health inequalities in their communities through continuous and robust community engagement, where the communities identify and implement strategies for change, building a shared understanding of the conditions that create health resulting from systemic and historical injustices, and then also by working on the policy systems and environmental changes that actualize community power. It's also really important to note that, SHIP recognizes that racism is a public health crisis. State and local public health SHIP shall prioritize and implement strategies and activities with individuals as well as their communities that have suffered and experienced systemic racism and oppression. So again, I know you guys are probably familiar with this, but just to cover it, SHIP really has 4 context areas that their work reaches. So Minnesota Eats, that includes initiatives and things such as like breastfeeding friendly policies. Minnesota Moves, that can include strategies such as safe routes to schools initiatives. And then Minnesota Commercial Tobacco-Free Living, that could include things such as smoke-free housing policies, and then the newly added Minnesota Wellbeing, that could cover things such as comprehensive worksite wellness policies for employees, well-being, and resiliency. So in this training, the examples that we're going to provide of the policy systems and environment change will focus on these context areas along with the 4 settings the SHIP work supports, which includes that worksite, schools, healthcare settings, community, and then early childhood and education center settings. In many cases, you'll see that we have similar policies in multiple settings, and that some policy changes can also be systems changes or environmental changes, but we'll talk more about that in the presentation. So for today's topic, again, it's all about level setting. We'll go through our developed definitions of policies, systems, environments, why they matter for public health, and then provide some examples of how PSC change can be implemented in the different SHIP context areas and settings. I'd like to mention that the definitions developed for this training was a collaborative effort that included MDH, OSHI staff, OSHI as well as SHIP staff, the PHLC team, and then the staff at the American Indian Cancer Foundation. So we'd like to thank, and I hope I'm pronouncing everyone's name correctly, but I do apologize in advance if I do mispronounce any of your names, but we'd like to thank Alice England, Holly Globitz, Fred Dip, Dylan Gallos, Christine Goodwin, and Christina Thiel, Donis Choza, Chris Johnson, as well as Chris Igo, Ann Zukowski, Shirley Sherry, and other unit leaders from OSHI So yeah, we'd like to thank you for your time, for attending the meetings and your efforts in workshopping these definitions. The representatives from all of these groups have met several times now to develop and discuss, refine, and refine these definitions. So we're really excited to share them with you all. Still, I should note that these definitions are a work in progress. So we made edits every time we've met, and so what we're sharing today is a representation of our progress so far. So now we would like to ask you a question to kind of get an initial sense of your experiences with PSC change work. More specifically, we want to know, how have policies, systems, and environments, whatever that means to you right now, positively or negatively impacted your health? So at this time, feel free to unmute yourselves or type your answers in a chat box. You can also raise your hand, but if no one's speaking, please feel free to unmute and share. And no pressure.
Hi, my name is Leanne Little Wolf, and I use she, her pronouns. And I'll turn my video on here. Example of a policy that affected my health positively is that when I had my children and their infants, when I had my first child, there was a policy that I could access formula. And then as I had my second child, there was a policy switch that focused more on breastfeeding. And so there was resources that I could get if I was breastfeeding. So there was certain foods and different, there were some benefits to that acknowledged that breastfeeding was good. And so that's an example of how I was impacted by a policy.
That's a great example. We have several examples that we'll walk through later that discusses breastfeeding and specifically. So thank you for sharing that. Folks have been putting in a chat about tobacco policies that have made it easier to breathe with outdoors, as well as insured spaces, safe drinking water, built changes to help maintain weight loss. That's a great example. Bike trails, awesome workplace policies where they combine, lunch breaks, and amazing. These are all wonderful examples and kind of touch on a lot of what we're going to be discussing in some of our examples, which in that note, I will pass it along to Julie. Thank you all for sharing your examples.
Yeah, thank you. I was just putting something in the chat about like some of the points about like the trails, built environment and having a trail available. Like I was like so impressed with how quickly the Minneapolis Park District plowed the trail near where I lived so that I could walk on it, because like the streets were just like impossible. You needed yak tracks or something, to move around. So so we're getting some great examples about smoke-free policies too, and it's lead-free paint, and then a workplace policy about being able to combine your breaks so that you have time to both eat and exercise, which is great. Working from home policies. So it's like, and it's, people are focusing on all really positive examples, but of course, we also know that there's ways that policies can make things difficult too, to sometimes live healthy, like if you don't have a good work health policy or that kind of thing. But anyway, we're going to get into that. So I am going to just talk a little bit about some sort of framing ideas. And, I think a lot of these things are reflected in just some of the ideas that folks have been sharing with us. But I think we all know through our work and just through our life experiences that policy systems and environments really can have a profound effect on our health. They affect both how long we live and the quality of our lives. And this is because policy systems and environments shape the opportunities and the choices that people have or a family may have, in any given sort of situation, whether it's at school or at work or out getting food or being out and about in a neighborhood. And policy systems and environments, or PSE, also drive how people, businesses, governments, and organizations of all kinds operate, including whether it's in ways that will help promote good health and better outcomes for people, or make these things more challenging to attain. And so, as you no doubt have heard many times as you've been working in public health, that it's very well established that medical care accounts for only about 10 to 20% of the contributors to healthy outcomes that can be affected or changed for a population, while those social and economic factors and the environments that we live in account for that remaining, 80 to 90%. And so that's why it's so important for SHIP to focus on that PSE change work. It is absolutely essential to achieve that vision where all Minnesota communities are thriving and that people have what they need to be healthy. And so that's what SHIP's PSE change work is about. It's about weaving health and well-being into the fabric of our communities and in ways that can be sustained and are sustainable across all the sectors and the seasons of our lives. Now, I have been using the words change and community a fair amount. And so the working group too that was working on these definitions realized we are relying on those terms a lot, so we should probably define them. And then I want to just keep in mind though that these definitions are in the context of SHIP's PSE work. So they're really specific to this SHIP PSE context. So here's the definition of change that the group had landed on. It's the process of modifying policies, which includes practices, systems and or environments in a sustainable way that promotes equitable health outcomes for everyone. So change is both a process as well as an outcome. And I want to just point out that that emphasis on sustainability and equitable health outcomes is because that's what is also a big part of SHIP's work, to make sure that the changes are going to be sustainable, meaning that it has to be things that a community supports, that is feasible for people or organizations to do, and which have some kind of an evidence base, so that they will stand the test of time and practicality and also be effective in actually advancing health equity. Then here's the definition of community that the group landed on. And this just happened last Friday, so these are very fresh. It is a diverse group of people whose connections and relations are shaped by geography, shared resources, needs, experiences, culture, and or shared environments in settings such as work sites, schools, and organizations. So the group wanted a definition that both encompasses the idea of a city or a town or even a neighborhood, something with kind of a geographic locus, as well as communities like a school community or a hospital community or a group of employees, so like a work site community. So now we're going to kind of move into the heart of this training, this webinar, is getting into those definitions of P, S, and E. So starting with policy, I think this is one that probably everyone's sort of familiar with. It's maybe one of the easier ones to wrap our heads around. It's essentially laws, ordinances, resolutions, mandates, regulations, organizational guidelines, rules, or practices. Their policies are set in writing. They set expectations that they will be followed or complied with. And they are enforceable beyond just relying on kind of social or cultural norms or sort of peer pressure kind of enforcement. Now, we know that sometimes people really can have a negative reaction to the word policy. It's kind of human nature that we don't like to be told that we have to do something or that we can't do something. And of course, there are certainly many, many examples of where policy has been used as a tool of oppression and trauma, especially against Indigenous peoples, immigrants, Black people, Latine, Asian people, and other peoples of color, people with disabilities, and other people who've been socially or economically marginalized. But just as policy has been used in these negative ways, it is a powerful tool for positive change. And so I think it is important that we reclaim that and own that and claim the power of policy in service of health equity. And I will just say that if it's a semantical thing, if it's just the word policy that is causing maybe some heartburn for people that you might be working with down the road, it's okay to call it guidelines or just, something, whatever works for the group. But the important thing is not what it's called, but it's that it's in writing, that people are expected to follow it, and that there's some kind of way to hold people accountable for following it. So that's matters more than what it's called. Now, a big and ongoing conversation that the group had, and I know this comes up across shift work in general, is the role of unwritten policies. And so you'll see that the definition of policies includes practices, which then we defined as unwritten policies, such as deeply rooted customs or consistently followed patterns of behavior or activity. So practices also set expectations that they will be followed by people or organizations, but because they are unwritten, the main way to enforce them is through that social and cultural kind of norm, or sort of that sort of social pressure or social habit. And so for some communities, such as some tribes who come from very strong oral traditions, or some organizations where it's part of just their culture to have more like practices or unwritten policies, practices can be a very strong form of policy, but the challenge is that if policies are not written down, they are more vulnerable to change, such as a leadership change. They can cause problems with consistency because they might be implemented differently by different people, or sort of interpreted in slightly different ways by different people. And they can be difficult to enforce, especially when it comes to newcomers or outsiders, people who may not be as familiar with those traditions or customs. So even though practices are valuable and a legitimate form of policy, people and organizations, for the purposes of ocean ship work, people and organizations are really, should be thinking about translating those practices into written policies as much as possible. That is a recommended practice, and it's also really important for evaluation purposes. And I'll just say that if you have some questions about how to navigate this in your ship work, please check in with your ship contact. And I saw there was a question about OSHI. Thank you, Cassandra, for providing that acronym. Sorry for not explaining that before. Okay. Now we're going to have a little chance to talk about this some, but first we want to kind of give you some examples of what a policy change might be in the specific 4 context areas for ship work. So in the Minnesota East example here, I have a breastfeeding support policy, and keep in mind that this is applicable to all types of settings. You can have a breastfeeding support policy in any type of ship setting, but the type of policy might vary a little bit, of course, depending on the setting. For example, in a clinic, you could have a breastfeeding kind of clinic or breastfeeding friendly hospital or clinic policy, or a policy that provides for reasonable and flexible break times and a good space for employees to pump or to feed their babies at work, or a policy about educating new parents about breastfeeding while they're in the hospital. There could also be a school policy, again, one for staff and one that is about for students, which they will be similar in some ways, but also may be different. And again, for a childcare center, could have a policy about supporting staff who are breastfeeding, as well as supporting parents and children in care who are breastfeeding. And that could be in different ways, talking about milk labeling and handling. It could be about connecting new parents, parents of newborns with resources, or even expecting parents with resources to help support them in breastfeeding if that is what they want to do. And then, of course, a breastfeeding support policy could be applicable at any type of work site. You could also have a community-wide policy that supports breastfeeding across all kinds of work sites, or as a right to breastfeed within the community. I will note that there's also a really good well-being connection to breastfeeding policies, because there is a lot of good evidence that breastfeeding promotes bonding, of course, between parent and child, as well as being linked with reduced rates of postpartum depression and improved mental health for the breastfeeding parent, as well as improved morale, retention, productivity, and job satisfaction for employees who are coming back to work and breastfeeding. Then the Minnesota Moves context, we have an example from the school setting that also relates to well-being. And this is an example where an elementary school could have a policy where they say that recess will not be withheld as a form of discipline or punishment. And so that is a good policy for ensuring that kids aren't losing an important opportunity for some physical activity and a sort of a mental break in the day, as well as for connecting with their peers. And then in the Minnesota well-being context, we have an example of a policy that requires managers to get training, to be provided with training on how to support their staff in dealing with workplace or life challenges, or be trauma informed in dealing with their staff, or it could be with their customers in public as well. And again, this could be a policy that could apply to many types of settings, including schools or a childcare or a healthcare setting or any type of business. The nature and the focus of the training would vary, of course, by its setting, but it's applicable. Rachel, do you want to talk about the commercial tobacco-free living example?
Yeah, great. Thanks, Julie. Yeah, so I wanted to give an example in the commercial tobacco-free living policy area. And an example here could be a community or school seeks to update their K-12 school policy to better reflect new products, like not so new anymore e-cigarettes, but some of these like synthetic nicotine products and things like that that are out in the communities, and schools' policies maybe haven't kept up with some of those products. Another thing that we see in the commercial tobacco context is schools really wanting to not send a mixed message to youth by accepting industry support. So a lot of schools have actually embraced a policy that they won't accept any funding, resources, curriculum from the industry for their schools. And this is really important because we want to make sure that school is a safe, nurturing environment for kids, and a mixed message is definitely sent if you're saying don't use these products on one hand and then accepting funding from the industry on the other hand.
Thank you, Rachel. So now we want to give all of you a chance to just chime in here again with some ideas. We know we're getting ready for this new SHIP application package to come out. Some of you have been doing SHIP work for a while too. So we just want to ask you to share, if you would, about maybe either what kinds of policy or policies are you thinking about working on for SHIP? What are you excited or interested in? Or if you've done SHIP work in the past, what kinds of policies have you worked on that you've enjoyed or that you found successful, or even, maybe that didn't work so well, but you learned something from. So if you, again, would please feel free to unmute and jump in, or to put things in the chat. I am seeing some things popping up in the chat. Thanks, Sophie. Talks about working on a community engagement policy and school policies for wellness committee, triennial well-being in school. So was the community engagement policy also for the school, Sophie? Maybe I'll give you a chance to, for the community. Okay. Then Keith talks about incorporating suicide prevention and mandatory training criteria. Suicide prevention training. Yes, thank you, Keith. That's a great example. Gina talks about doing tobacco policy updates. Alyssa similarly talks about commercial tobacco-free grounds at a healthcare facility. Elizabeth mentions childcare policies regarding nutrition intake. Breastfeeding policies from Samantha. Christine talks about vending healthy food purchasing policies. And then Patrick says he's going to be serving on a committee this year to create a complete streets policy for Otter Tail County. That's great. Then Michelle, assuring the health education standards are taught to every student in K through 12. Donation guidelines for food shelves, lactation support. Mohammed talks about Somali community resettlement services. Very cool. Childcare policies, food shelves. So like lots of great examples. Yeah, I think people have really like it's you kind of know, what this is about. I see, I just want to call out Carrie mentions an example about well-being in schools, adding a quiet room and policy for including use. And so that's also, you can just note that, that's an environmental change too, right? As also like you're adding this space. So that's also changing the environment. And then adding them on the student's IEP and our behavioral assistance plan, that sounds like it could be a system change. So that's like kind of a preview of kind of some of the things we're going to talk about how all these different things are connected. All right, thank you so much. These were really great examples, everyone. I really, really appreciate that input, and I hope other folks here too, when seeing this, get some great ideas. So with that, I am going to turn things over to Rachel to take it from here to talk about systems.
Great, thanks a lot, Julie. This is really energizing and exciting to see all these amazing opportunities that people are taking at the local level. And I just wanted to note, MDH does have a really great toolkit on their website for commercial tobacco work, specifically around e-cigarette use and prevention for schools. So I put that link in the chat there. So I'm gonna just read through our definition of systems that the group came up with. Processes, procedures, relationships, and power structures in a community or organization, the way organizations and communities operate or do their work. And the way I think about these interrelated systems, I love this image of the gears because I think of it as this machine, the gears underneath this machine that you may not always see operating explicitly, but they are back there operating and doing and setting up, manufacturing, whatever, sometimes for good, sometimes not so good. But they really do shape our environment and are frequently driven by the policies and practices that we follow in our communities as well. And I want to recognize this specifically, the power structures, I think is a really important part of this definition, because this really exposes the idea of how decisions are made. That's a system, and who is making those decisions really are key parts of the system that can either facilitate or be a barrier to some of these changes. So, really thinking about that as an opportunity for some of the change in your work. So I did want to we're going to give you a few examples of where the systems may crop up specifically in your work. So I think, Julie, you're going to take the first example.
Yes. So again, kind of carrying on the theme with the breastfeeding policy. So the Minnesota Eats example relates to that. And so like say, if you had there's a childcare program and they, have a policy about creating a space for parents to come in to nurse or to pump their baby during the day. You could also have a policy, you could also have a system change as part of that, in that looking at how the program operates and staff are trained to talk to new parents about this option, about how to put it in place, some systems to help parents understand what the child care program does to support breastfeeding, and also how to connect parents with additional services or supports that they may need. Because, breastfeeding is not, I've breastfed 3 babies, so I know this. It's like, it was really hard for me to learn how to do it. I needed a lot of help. Ultimately, it was super successful and I'm so glad, but it was challenging. So, helping staff to understand like what they can do to help new parents can be really helpful in terms of making a breastfeeding support policy real. Then in the Minnesota Moves context, we also, this is about a sort of active or safe routes to, something within the community parks or food outlets, but it could also be, so it's about active transportation, but it also connects with well-being, as well as also like it could be a Minnesota Eats, for example. And so the idea is here that that a community is prioritizing these identifying these routes to parks or to healthy food outlets in community planning process, and working with community members to figure out, which parks, which food outlets do we need to be focusing on to do that. And then with the Minnesota Wellbeing example, again, as Rachel mentioned, that the systems change, a big part of that is looking at how decisions are made. And so in a work site setting, you could change your systems and thinking about how are employees involved in the decision-making processes for that workplace, and particularly for things that are going to be really important, things like wellness. It could be about the telework or remote work, activities like that. How you are engaging employees in a really significant and meaningful way.
Thanks, Julie. And the example we wanted to give for the commercial tobacco-free living context is the major shift that communities are making away from just focusing on punitive penalties for youth for purchase, use, and possession for commercial tobacco products, and instead focusing that energy on the retailers and looking at enforcement policies that are really focused on holding those retailers accountable. What we have found is that just simply punishing youth for using these products or purchasing these products does not solve the problem. We need to keep them out of the hands of youth. And so it's more appropriate in the context of a tobacco retail licensing ordinance, for example, to focus on those retailers and following through on tougher, more stringent penalties for them if they are providing products to underage youth. So we wanted to, again, pose some questions to you. Since we now have a little more information about the differences between systems and policy, what systems changes are you thinking of working on for SHIP? Or what kinds of systems changes have you already worked on in the SHIP program? And go ahead and throw it in the chat or take yourself off mute and chime in.
Things are starting to come in.
Yeah, so I'm seeing one example of farm to school or farm to institution purchasing programs, which is absolutely a shift in our thinking on how we, move products through the supply chain. Helping workplaces recruit wellness committees, EBT at farmers markets, implementing health in all policies. And then the smarter lunchroom systems. Sorry, they're coming in so fast I can't even read them all. Make this bigger. Reorganizing internal process for legal approval of SHIP project materials. That's a great example of working within your own challenges you may face in your program. All right, well, these are really fantastic examples. In the interest of time, I'm gonna move on to our next definition, which is the definition of environment.
Hey, Rachel, I just want to call out, this is more for the MDH folks. There is a question from someone about if SHIP would want to address K through 12 health education. So you just might want to make a note of that and circle back later. Sorry, go ahead.
Great. All right, so I'm gonna, you can change the slide to the environment definition. So what is environment? The group came up with this definition. It is settings and spaces within which organizations operate and within which people live, work, study, play, and pray. And we have a couple of caveats on this definition. It can be both tangible, so it might be the physical structures of your built environment, or it may be intangible. And so these might be some of the cultural, social, or economic dynamics that are at play in your community. And I'm going to call on Julie to just say a few words about this illustration on the slide, because it's really an interesting example of a community really re-examining and changing their environment.
Yeah, and this is a great example of a community that's thinking about its built environment, but then also thinking about how that environment reflects its like social and cultural values and priorities. And this is from the Thunder Valley Community Development Corporation. They've been working with the Lakota community at the Pine Ridge Reservation to develop this holistic project, which includes a community development or sort of built environment component. This particular part of the work is called their Thunder Valley Regenerative Community Development. And the goal is they are creating a community that includes homes, businesses, stores, museums, recreation spaces that reflect the values and culture of the Pine Ridge Lakota community in a way that's healthy, innovative, and culturally appropriate. And so you can see they are after they held many meetings and workshops with community members to get their opinions and input onto the design. They actually had to radically change the design after doing this because they came up with this more circular kind of design that incorporates the hoop or the medicine wheel construct, which is a very sacred and important construct for the Lakota Pine Ridge community. And then organizing the way the single family homes are built. So they're similar to the ways that their Lakota ancestors organized their teepee clusters, and then with their shared community spaces being centralized around the space for the powwow grounds, the farmers market, and the artist market. And it might be a little bit hard to see from this image, so I put the website URL there so that you can go there and learn more about this initiative. And it's really cool and very inspiring. It includes a food sovereignty initiative, a Lakota language restoration and revitalization project, as well as they're working on building social enterprise capacity for community members and supporting affordable homeownership and economic liberation for members. So it's just a great example of a change that is about the environment, but in a multifaceted way.
Yeah, that is an amazing example and a very ambitious example of completely overhauling one's environment. So thanks for sharing that example. We are going to talk now about some specific examples in the SHIP context. And again, Julie's going to start out with the Minnesota Eats example.
Yeah, so again, carrying on that breastfeeding policy theme, a big part of a good breastfeeding policy is having a space to do it in. So that requires adjusting the environment, the physical environment, so to create that space. And so this is the idea of creating a lactation space or a facility to support breastfeeding could apply to, again, any of the settings that SHIP is working in, because it could be a space for employees, it could be a place for students, it could be for community members, but it's going to be a change to the built environment. And then similarly with Minnesota Moves, I know one of the big strategies is active transportation and supporting biking and walking. And so a change to the built environment to support that beyond like trails and sidewalks and things like that is making sure that organizations or food outlets or stores or work sites have facilities to support it through things like having a bike rack there, or maybe it's a locker room at a work site, things like that to help make it easy for people to be physically active, getting to work, and then and throughout the day. And then with Minnesota Wellbeing, we have an example again of as somebody mentioned this actually too in the chat in the policy section, but creating a quiet room or a wellness space that could be for students or for employees to support well-being and resiliency. And so again, that's creating that physical space within an organization to support people's mental health that way.
Yeah, and our example in the commercial tobacco-free living space is reducing youth exposure to commercial tobacco in retail environments and other spaces in the community. And what we do know, there's evidence that the more exposure youth have to these products in retail environments, for example, the more likely they are to want to use those products and actually use those products. And so some of the policies that we include in our model policy for local tobacco ordinance would be things like reducing the density of the tobacco retailers in a community, either by requiring them to be further away from things like schools and parks, or even further away from each other. So having a distance requirement between the retailers. And then of course, in the school and other contexts, you know, having commercial tobacco-free campuses, having commercial tobacco-free workplaces, things like that really help to ensure that young people are not exposed to these products and therefore attracted to the products. So, and with that, we're going to ask again, give us some examples of environmental changes that you're thinking of working on for SHIP, or things that you already have been working on with SHIP or other programs. Right, I'm seeing community-based agriculture. It's a great one. Mother's rooms. Sunsetting tobacco licenses in a city definitely reduces the number of retailers out there. School staff calm rooms. That's a good example. Development of space for Somali women to exercise. Indigenous farmers market. All right, those are some really great examples yet again. And I see people are putting some links in there too that we could take a look at, you know, what people are working on in their community. So with that, I'm going to pass it back to you, Julie, to talk about how this all comes together.
Yeah, and so, you know, in the last sort of bit here, we thought it would be helpful to just try to kind of connect the dots for people a little bit. I mean, again, some of you are already probably pretty comfortable with this, but some of you, this is still kind of newish. So I just want to show people that, you know, we've been talking about policies and systems and environments as separate things, but even as many of the examples that we're seeing in the chat reflect, there's a lot of overlap. The lines aren't really that clear in real life, you know, necessarily. And so, and that's okay. You know, these things, they all work together. As this diagram kind of tries to show, you know, it's a very much a reiterative process. The environment kind of affects the policy, and the policy affects the systems, and it affects the environment, and so on. And so just we wanted to walk you through a couple of examples that kind of show how these things can sort of layer on or interrelate to each other. So here is an example of from the Minnesota Eats category. And let's say, so a food shelf has this develops a policy that they're going to provide healthy foods to their clients, and they're going to eliminate even the unhealthy food donations that they're bringing in. So that's their policy. And so in order to make that policy work, they're going to have to change some of the things about how they get food. And so one of those things might be working more with local farmers or a farmer's market or a grocery store to get the leftover produce, so they have more produce options to offer people, or to connect with a gleaner or do gleaning, you know, have staff who can help with gleaning to get that produce from a local farmer. And also part of that could be working with their clients to identify the types of produce to prioritize, or types of healthy foods to prioritize. And then how that's going to change that environment in that food bank or food shelf is that there's going to be more healthy foods available in that space. They're going to be displayed in ways that will make them, you know, easy to see, appealing. There's no signs, things to educate people about what the healthy choices are. It's like these are tools that you put in the environment to help people know how to make these better choices. And I just want want to also point out that this also incorporates a community engagement. I mean, connecting with the farmers and other local partners, that helps build relationships and deepens the food shelf's capacity and resources to provide these healthy foods. Also working with the food shelf clients to get their contributions and ideas about what they want to see in that food shelf is going to be a really valuable process for both building buy-in to taking those foods and also sustainability for that policy. And this strategy also reflects an equity focus because it is about supporting access to healthy foods for people who are food insecure, and that working with your clients to identify the produce or other healthy foods to prioritize strengthens that equity focus. All right, and then just another example of this from the Minnesota Moves context. And again, so just to walk you through the example quickly. So imagine that there is a city or a town that decides to either create or update a bicycle pedestrian plan to support more biking and walking throughout the community. And then in order to implement that plan and operationalize it, they make a systems change. They create a bike ped working group made up of community members who, because of their input, change the cities or towns' criteria for how they decide what sidewalks or trails they are going to build or renovate to prioritize access to parks or to a healthy food outlet or to some other important community source, and focusing on people who are living in low-income neighborhoods and have reduced access because of that. And so then this is going to, of course, result in environmental change. There's going to be more new and improved sidewalks and trails throughout the community, connecting people to these community resources. And again, this work has a strong community engagement component through that working group. And of course, it would be important to provide these community members with supports like, offering a meal, providing childcare support or transportation help or stipends, both to show value for their time and contributions, as well as to make it feasible for them to participate. And it also reflects an equity commitment by prioritizing low-income neighborhoods, and presumably the folks who are on the working group would represent those neighborhoods as well as come from other parts of the community, so that the prioritization process reflects an equity criteria. So those are two examples just of how these things kind of connect and weave in together. Now we just want to take a few minutes to find, okay, so are there any questions or any reflections that you would like to share with the group? Any lingering areas of uncertainty around P, S, and E? Again, knowing that it's a work in progress for all of us.
I have a quick question. This is Esther.
Sure.
So when there is a proposed activity from the community, and since you mentioned like everything is kind of interconnected, what's your recommendation when it comes to starting to identify policy, systems, and environmental change for a project?
So Esther, you mentioned something coming from the community. What could you say a little bit more about that?
Yeah. So let's say I had a meeting with a group of community members, and there was a project that was proposed. When coming back in to see how it relates to PSC changes. Mm-hmm. How do you begin the process, or like what do you tackle first? Is it policy, like in terms of thinking, do you tackle policy first, systems? Like how do you go about all of that, since things are kind of interconnected, and report to or work with community?
Yeah, so I guess I will also just want to make sure that any of the SHIP community specialists who are here on the phone, feel free to jump in, because you know I know you are really immersed in this SHIP application process. But I will say quickly, just it really this is kind of very abstract, so it kind of really depends on the area, the type of project that they are that the community members are talking about. So I think that you know, presumably it's going to have to be something that will fit within the SHIP context areas, the Minnesota Eats, Moves, so and so forth, as well as thinking about the settings. But I mean, I just start thinking about these components, and then thinking about what is the change that they're hoping for, what's the goal of the change, and then you have to kind of start unpacking that. Thinking about what that goal is, and then how does it link to whatever kinds of policy systems or environments are currently in place, because there's going to be something that's already shaping how these behaviors are, you know, what people are doing now. And so thinking about what are the things that could be adjusted or changed, so to support people in having healthier choices available to them and making those choices. Does that make sense?
Yes, thank you, Julie.
So, yeah, so Chris is kind of echoing that, Chris Haugen, that's organic. And yeah, that's a great word for it. I think it is very organic. It's going to be, and it's going to be a little bit, I like to use the word reiterative. Like, you know, you start from one place, you get some information, and then you kind of have to go back and revisit your assumptions or your ideas, and just kind of having that back and forth. But I think that is part of the work. To me, I always tell people policy, when, you know, before I went to law school, I thought policy, like 90% of the work is writing it down. Actually, that's like a very small part of the work. Most of the work happens in those conversations, in that discussion with people, figuring out like what is driving the situation right now, and then what can we do to change that. And what will work, you know, what can we do to change it in a way that people are going to like, or at least not actively oppose, or if they do have concerns, how do we address that? I mean, it's such a back and forth process. So Ruth is asking for a sample lactation policy for work sites a few years ago that we had. They're asking if we can post that again. So Ruth, we're actually working on a toolkit for tribal breastfeeding policies that has several examples of policy, which, you know, are many of the policies are really, it boils down to providing that space, providing the break times, providing the flexible numbers and time, so that kind of thing. So that will have some examples, and we'll have that on our website.
I'm Julie. Yeah,
yeah.
This is Holly too, and there is a sample policy on the breastfeeding Basecamp.
Okay.
And I can also post it in the worksite section of Basecamp as well. The Minnesota state law updated their language.
Yes.
So we updated the language in the sample policy, and I will post it.
Thank you, Holly. Any other questions? All right, well, we are gonna wrap up here. Safia, do you want to chime in?
Sure, yeah. So looking ahead, as I stated, this is the first part of the 3-part training series. So we will actually be having a replay of this training this Thursday, June 2nd at 11 a.m. And we'll have a live Q&A session as well. So for any folks who might have missed this, you might want to forward this information to them, or have you guys rejoin us. We'd love to have you again. And then the next training will take place June 29th, and this one will cover PSC change work and program work to improve health, synergies and differences. So, and then we'll have one more training following that, actually 2 more, the 3rd and 4th. So, and we'll post that information on Basecamp as well. And yeah, and then ways that you can register. So, and we'll send this recording as well as a presentation for you all. So you can click the link and register for both Thursday replay, and then the 29th, June 29th training. So, and then if you have any additional, go ahead, Julie.
Oh, I was just saying, Chris just made a plug to come to the coffee chats and meetings for settings or behaviors and learn what your partners are doing. Also, I don't know if anybody else from OSHI wants to, or MDH wants to chime in. But yeah, that was it. So thank you, everybody.
Thanks, everyone.